Good morning, everybody. Dr. Vasquez here, coming to you live right now to talk about clinical nutrition pharmacology. I believe this is installment number 8. And what I'm going to do right now is talk about vitamin A. So I have talked about vitamin A previously. I did 2 other videos. One was kind of antiviral nutrition generally. And then I did another video specifically talking about the potential toxicity of using an antiviral nutrition protocol. And obviously, vitamin A is part of the antiviral protocol. And it's one of the nutrients that can be toxic at approximately its therapeutic dose. So we call that the therapeutic index, which is how much space do we have between efficacy, let's say, and toxicity. And with vitamin A, sometimes we have to use high doses. I'm going to talk about that. Oops, sorry for moving the camera. I'm going to talk about that right now. And we have to know how to monitor for toxicity. So again, I probably won't repeat everything that I said previously in the other videos about vitamin A and specifically the toxicity, because I'm just going to do this spontaneously. And, you know, the value of doing things spontaneously at times is that it's a different perspective. It's fresh. It's not just me, you know, reading the same slides or looking at the same, you know, template that I've used before. I'm just going to give you what I think is important, and I think that will be sufficient, but also, like I said, different from what I've presented previously. So the only thing I want to reference that I have done previously is last year, I believe last year, or the year before that, I'm not sure exactly. I guess it was last year. When we were in Argentina, I was able to finally understand a good template for discussing pharmacology. So I am going to reference that. And I've written it down on the screen just a few moments ago. And that was the facile pharmacology acronym that you're looking at right here. So as you can tell, F stands for function. So this is kind of a conversational template. Like if you were to, or in this case, I'm going to talk about vitamin A. If we were to talk about a vitamin, this actually has not simply a template, and it's not simply an acronym, of course, but it's actually, in my opinion, kind of conversational. I mean, this is the way we would kind of flow through our understanding of a vitamin. So I'll just talk about that real quickly and see if I want to then use it for vitamin A. So the first one is function. So you would need to know what the vitamin does. You would need to know how to administer it, looking out for complications, contraindications, and other cautions. The I is for interactions. So, for example, in some cases we would say, oh yeah, sure, this treatment is great, but not for people with X disease or taking a certain drug. So sometimes you have to think not just about the agent that you're using, whether it's a drug or a nutrient, but you also have to think about the kind of the context and specific to that patient. What diseases do they have? Like kidney failure, for example, that changes a lot of games. What diseases do they have, or what drugs are they taking? Lab tests and any exceptions. So, you know, that's just another level of knowledge and clinical wisdom, we might say. You know, so for example, a good teacher or a good student might learn these things, and that's great, or at least good. But, you know, with time, age, experience, we also learn the exceptions to those rules, not simply the rules. So maybe I'll revisit that in just a moment, but I am going to talk about vitamin A. Vitamin A has been one of my favorite nutrients for a long time. You know, in a certain sense, I guess all nutrients are my favorite nutrients at the appropriate time. So if somebody needs vitamin D, they need vitamin D. And then it's the game changer of the day, so to speak. And the same thing is true of vitamin A. It can definitely be a game changer. Again, I've reviewed a lot of the pharmacology and lab assessment previously, but let me see how I want to approach this. I guess I will use this template. So, let me change colors here as if that matters, but here I go. So again, this is the facile. In English, the word is what? Facile or facile? In Spanish, it's just facile, but basically the same. And the E is somewhat optional. So if you don't want to use the E, you don't have to. Sorry, my screen's misbehaving. So let's go with the function of vitamin A. FX, function. Kind of on a molecular basis, vitamin A gets transferred to a nuclear receptor. So it basically acts kind of like a nuclear transcription factor along forming kind of a heterodimer with the vitamin D receptor. So I'll just say this. I'll just say it impacts genetic expression. In contrast to other vitamins that I've already talked about recently, like thiamine, vitamin B1, riboflavin, vitamin B2, and pyridoxine, vitamin B6, those all function as cofactors for enzymes specifically, or coenzymes, I should say. But when we talk about vitamin D and vitamin A, those have a direct impact on genetic expression. So let's see, how else could I say that? More specifically, we see that vitamin A plays a role in epithelial maintenance. And also cellular differentiation. That's important. So epithelial maintenance, epithelial tissue, so epithelial tissue is like your skin. It's also like the skin inside your mouth, mucosal epithelium, and also the gut epithelium, which is usually columnar cells, etc., within the gastrointestinal tract. So to maintain barrier defense, like your skin, in your mouth, in your lungs, in your trachea, in your throat, in your gut, you have to maintain those tissues. If those tissues are being attacked, so-called by an infection, then you would reasonably expect that the nutrient requirements for those tissues would also increase. And indeed, that's the case. Cellular differentiation. So when cells are deprived of vitamin A, they tend to revert to a more primitive form, otherwise kind of pushing in the direction of cancer. So vitamin A has been long known to have a pro-differentiation effect, which means it helps cells become what they're supposed to become, not just become blobs of cells in kind of a precancerous state. And I suppose, in addition to those things, I could also clarify that vitamin A is very important for immune function. Now, when I talk about immune function in this context, I'm not just talking about, the so-called white blood cells, but also barriers, and specifically epithelial maintenance. So the old way of looking at, or the old way of talking about the immune system, this is a very important point. The old way of talking about immunology and immune function was to focus on the so-called effector cells of the immune system. Lymphocytes, macrophages. Let me see what's the list? Neutrophils, lymphocytes, monocytes, eosinophils, and basophils. I mean, those were kind of like the original main immune cells. And then we found out about antigen-presenting cells. And then we found out, well, sometimes cells function full-time as antigen-presenting cells. But a lot of cells, now we know, just about every cell type you have can function as an antigen-presenting cell. They're just not professional APCs. And so ultimately, the newer way of looking at the immune system is that your entire body is the immune system. It's not just your white blood cells. It's not just the APCs. It's not just the full-time or the part-time APCs. Your whole body is your immune system. So when we talk about defense against infection, for example, we have to take into account the entire body, and therefore we have to take into account all of the nutrients necessary for the different cell types in the body. So, vitamin A was originally called vitamin A, supposedly, because it was specifically noted to be important against infection, and that's why it was called the anti-infection vitamin. So whoever the earlier researchers were, they noticed that when animals did not have enough vitamin A, they became ill. When they gave them vitamin A, they resisted those infections. And that's why vitamin A was initially called, around the time of its discovery, vitamin A, because it was the anti-infection vitamin. All right, so let's see if I can build upon that. Administration. Administration of vitamin A is usually oral. And a lot of times we give it in big doses, like so-called bolus doses. I have some resistance to using the term bolus dose because it's been so horribly misused with regard to vitamin D. But for vitamin A, it's probably still appropriate. So obviously you can do kind of chronic dosing, chronic daily or weekly dosing. You could just put someone on a pretty steady dose, or maybe once a week you could dose them if you want to do it that way. But more commonly, I would say, we think of using vitamin A in bolus doses. So we just spike it, and maybe a month later we spike it again and we spike it again. That seems to work. I think that that's an easier way to manage and perhaps even a better way to get clinical effects. Part of the idea part of the idea of administering high dose vitamin A, and I learned this back in the 90s from Jeff Bland, actually. And I'm not necessarily saying that this was his idea. As I recall, again, this would have been like 1995, so 30 years ago. So the lecture that I'm recalling from him, this was back, I guess this was back around the time that functional medicine started, because that was 1994. But Jeff Bland used to do a series of videos, or not videos, audio cassettes from his lectures, and that was called, that's when he was running a company called HealthCom. Anyway, it was a series of cassettes. And what he said in one of those cassettes, he was citing someone else's research, of course, but he said the idea between, I don't know why I keep saying between, the idea with using bolus doses of vitamin A is to kind of spike the liver and drive, this is almost an exact quote from 30 years ago, and drive the vitamin A into the peripheral tissues. So maybe that's why bolus dosing actually works, is because you're not trying to load the liver, which is the preferred storage organ for vitamin A. You're actually trying to bypass the liver and push this vitamin A. You're trying to kind of overwhelm the liver, so to speak, and push this vitamin A into the peripheral tissues. So that's part of why vitamin A is administered typically in bolus doses. Obviously, it's also just more convenient, especially in so-called underprivileged settings or poor settings or vaccination programs and things like that. So that's why you'll see, with a lot of nutrients, we talk about daily dosing, like 200 milligrams a day, 600 milligrams a day, whatever. But with vitamin A, we more commonly talk about 200,000 units for 2 days, and then in another month or so, 200,000 units again for 2 days. And that applies to infants, children, and adults. Let's see, I was just about to say something else, but maybe this is, let's see. Oh yeah, so I did kind of offhandedly, I mentioned that this is good and bad, so this is something worth paying attention to. As if you weren't paying attention to the other parts, I assume you are. But I did mention spontaneously that vitamin A is often used in bolus doses, and this often coincides with vaccination programs. And everybody knows this, who's ever studied public health. Or you can just go to the World Health Organization, WHO, and you can look it up on their website. But one of the common strategies for decades has been the administration of zinc, iron, and vitamin A along with vaccines, because they say, it's just more convenient, and it is convenient, to give these kids, usually in so-called underdeveloped countries or oppressed countries, it's more convenient to give them vitamin A, zinc, and iron, because those kids are usually deficient in those nutrients, along with the vaccinations. They do that. They talk about it on the World Health Organization website, World Health Organization. But who gets the credit? What intervention gets the credit for the benefit? Obviously, it's the vaccines, right? So let me say that a different way for those of you who want to hear it a different way or who didn't get it the first time. They take these kids who are nutrient deficient and therefore vulnerable to infections. They give them a vaccine, and on the side, they give them an injection of vitamin A, or they give them vitamin A drops, and they give them iron and zinc. And then when the kids don't get sick, they say, the vaccines did the work. It's just total bullshit. But anyway, that's what happens. And you can see that I mean, that's well described in any research that you want to look at. On the World Health Organization website, they just say, oh, well, it's just convenient to give these kids vitamin A along with their vaccines. No, you're not giving vitamin A along with the vaccines as if the vaccines were the priority. You're giving the vaccines along with the vitamin A because the vitamin A is what protects these kids. And that also accounts for reductions that you see associated with so-called vaccines, even though if you were to look at the biological plausibility of reductions in mortality after the use of vaccines, the biological plausibility of that is essentially non-existent in many cases. But oh yeah, they forgot to mention that they gave the kids vitamin A at the same time, and that would explain the reduction in mortality. All right, so obviously I need breakfast, but let's just see. Administration. So yeah, the bolus dosing, and if you're a pediatrician working with neonates, obviously you can look this up, or maybe you already know it, or maybe not. But here's the way I would do it. This is the way I would do it spontaneously. Obviously, most of my clinical practice has been with adults, thank goodness. Although I have delivered plenty of babies, I have no interest in neonatal medicine. But if I were working with an infant without looking anything up, this is kind of the guideline I would use. So I'd go infant, kids, adults. For an infant, I would keep the dose certainly not higher than 100,000 international units on 2 different days. For non-infant kids, I would use 200,000 international units times 2 on 2 different days. I mean, that's standard. For adults, you have a bigger range there depending on how aggressive you want to be. And so in the past, based on the standardized recommendations, which were usually capped out at 200,000 international units per day, that's fine. For many, many years, that's what I did. But as some of you know, in some of my more recent videos, even including this year in 2025, I have started